Well, good afternoon, and thank you very much for having us here today. We're delighted to be here. I'm delighted to bring some news of Duchy Health to you. I'm hoping that by the end of the afternoon you'll have at least some questions, and you may even have some information that will help you in your journey. Duchy Health Charity has been active in Cornwall for a long time, but it has very often worked sort of below the radar a bit. Our reasons for being here, basically, are to do with the promotion of health and well-being and the prevention of sickness. Now, we used to wrap it up in all sorts of very difficult terminologies and all the rest of it, but actually that's what it's about. And our view is that if we can help people to stay well, then they won't need the more difficult services that they find difficulty accessing later. So the phrase that has been used over recent years has been social prescribing. Well, we didn't know we called it that, but we've been doing it for a very long time. And actually, I'm sure some of you will now be well aware of social prescribing and all of that means. But where did we come from? Well, in the dim and distant past, there was a private hospital in Truro that what was to become Duchy Health Charity owned. They sold it, and they invested the money that they got from that into investments of about £5 million. That money has been invested ever since, and that was 1990 when we started. We've still got over £5 million in our pot, and yet we spend about 150,000, maybe 200,000 annually on giving to people across Cornwall. And it is across Cornwall. The Trust makes sure that there is always funding there. We don't ever endanger that fund, but we do go into it sometimes and then build the reserves up again if there's a big project that we really need to fund. I'll tell you about one of those later. We're completely volunteer run and led, with the exception of my sequined assistant here, Helen, who is our administrator, and we didn't know life could be so wonderful until she came to work with us. So she is the person who, if you lift the phone or you get in touch via the website, she is the person that you'll be speaking to. And she will guide you through any application that you want to make. And I'll say now that our guidance about what you can apply for is really quite straightforward. You need to be a charity or a CIC, but if you are neither of those, but you are being used or not being used, you are using an organisation such as Volunteer Cornwall or CCF, which you'll hear about soon, then actually they can be hosts for funding that we would give. So it isn't as blank as sometimes people think. Okay, so how do we go about doing what we do? Well, we don't just give money, we also cause things to happen. And I think that is actually what our trustees see as being probably one of our most valuable assets. So we anticipated by quite a long time social prescribing. We organised 3 conferences, for example, at one, they were supposed to all be at Eden, but then the little thing called COVID arrived, and we had to do 2 of them online. But that meant that we were able to offer information, advice, guidance to GPs and to practices about what social prescribing was, because the government in its wisdom gave GP practices and groups of practices amounts of money for what they called a social prescriber, but actually didn't tell them what it was. So we set about trying to do that. We produced a film so that they could use that with their own people in their own practices. But we can see very often, because of the applications that come in, we can see where there are synergies between our organisation and other organisations, and even maybe third organisations. And sometimes we're able to say, actually, did you realise that so-and-so over here is doing pretty much the same sort of thing as you're attempting to do here? If you were to share some of the back office functions, for example, you might actually save yourselves, both of you, some money. So we do make those introductions if we think that those are going to be valuable to people. Seminars and conferences we have done for a very long time. We have had some really important ones. We have had ones which are much smaller, but actually you can say almost on the nudge principle, getting ideas introduced, getting people to think about things differently. And now we would say that we have a whole network of people who know what social prescribing is, and we actually help 2 people to be employed working as social prescribers in schools. Because believe it or not, the government didn't realise that actually social prescribing would be just as useful for young people as it would be for adults. So we've been supporting that. And actually you'll find there's a recurrent theme here. We very often do work with children and young people because actually they're our consumers of the future, aren't they? And if we can get good habits with them in the way that they run their lives, you know, in the period when they're thinking about risky behaviours and all the rest of it, then that's going to be an advantage to us as a society as they get older. So, over the last 4 years then, we've worked a lot with social prescribing. And actually we've got some new projects coming. Hopefully, one I'm fairly certain about, one I'm less certain about at this point. But one that we're fairly certain about is going to be in Launceston. There's going to be a new centre in Launceston. They're taking over a premises, I think it's in Exeter Street. Forgive me if I'm wrong, but I think it's Exeter Street. Yes, I'm getting some nods. Good. Well, we are putting some funding into that to help them to refurbish those premises. And they are getting teams of workers going in from the NHS and from various other places to help people to make those decisions. So not just about health, but also how do I access help with my housing, for example. And that's a theme that will come up again. A long time ago, when I was a head teacher, we had an idea about how we could put centres for health into schools. Now, I'd like to be able to tell you that we have 7 of them across Cornwall. We have had 7 until recently, but unfortunately 3 that were funded by the NHS, I think they are closing. So other arrangements are going to have to be made. But the 3 that were paid for by Duchy Health Charity, which were at Penayre in Truro, at Budehaven in Bude, and at Hale down west, geographically spread because we were doing an evaluation of them as well. They looked at all sorts of issues that young people were worried about. Diets, nutrition, self-image, domestic abuse, housing. We're talking now about 14 years ago this cropped up. Sex and relationships, addiction, mental health, etc., etc. And we knew this is what young people were concerned about because they told us, but they also told their GPs exactly the same information. And there might be some additionals to that list, but pretty much it's the same now. And we're just opening another one of those down at Penzance at Humphrey Davy School. And basically, this is about information, advice and guidance again. It's not trying to tell young people what to do. It's not trying to interfere with their lives. It's in no way is it any intervention like giving them anything from an aspirin to a paracetamol or anything of that kind. It's not that kind of service. It's about allowing young people to go inside and to say, I've got a problem. They may not tell you in the first instance what the problem is. They might tell you about something absolutely different, but eventually they will tell you if they really are concerned about it. And when we set this up, under all those headings were considerations we thought about, except for housing. And the very first question we got in our integrated health centre in my school was from a year 10 girl, and she said, "Can you help me with my housing?" And so the lady that we'd employed, not a teacher, we'd employed to look after this centre, she said, well, what's the matter with your housing? She said, well, if I tell you that I have to put a tent up in my bedroom so that I can keep my books from getting damp. Yeah? Now, this is 14 years ago. Have we improved? No. So, the next centre, as I say, will be in Humphrey Davy, and I'm really looking forward to that. And that will open in September this year. The building is in position, and it looks remarkable. I'm really excited about it. I'm going down to see it shortly. But again, using the principles of social prescribing that we shall use in Launceston, they're going to be used there. There is a possibility that we might be able to have one in Liskeard as well. That has been spoken about, but we're in very early stages of thinking about it. So not yet, but hopefully. Okay, so how can we help? We've got, we think, a fairly easy grant application system which goes online. Helen is our principal backup to that, so if you have any queries at all, she will help you through it. We are setting up a new website and it's about to go live, so if we do have any hiccups, we'll advertise the fact we've had hiccups and it won't stop you doing any applications at all. We look at these applications 4 times a year. There is nothing too small. So if you think, actually, we just need £300 or £400, I think the smallest one we did last year was about 800, I think. Yeah. Fine. It's nothing too small. If you think you need something larger, fine. But we have escalations. So, for example, some of them we can agree just by email. Some of them would have to wait for our grants meetings. Some of them, over £30,000, for example, have to go to our board for discussion. So, that's the way that we ramp it up, if you like. But we can support you in, as I've said, many different ways, and I hope that you'll find a way into that, even if it's by using one of the organisations like Volunteer Cornwall that we have used before and have been in partnership with. We don't give grants to individuals. We don't give grants to commercial businesses. We don't give grants to profit-making organisations or groups whose beneficiaries are not people or applications that duplicate an existing provision. So one of the questions on the website will be, who else is doing this work? And if it's a very localised organisation, for example, the fact that somebody else at the other end of the county might also be doing it is not, it doesn't stop you making that application. So we just need to know where these are so that we can actually see if there's any synergy between them or not. One thing we did, I suppose it would be 18 months ago now, Thomas could probably remember more accurate than me, but when we realised that cost of living was going to be a real problem for Cornwall, we got in touch with Thomas, said, look, from Cornwall Community Foundation, and said, look, why don't we combine our bucks and your bucks, make a bigger bang all together? And that's what we did. And basically we gave Cornwall Community Foundation £50,000 from us to help them with what they were trying to achieve. And I think that was a very sensible way of us reacting to a situation that we were all trying to deal with. And I was very pleased about that. Thomas is nodding. Thank you. So we did that, and we'd hope to do it again if the need was there, and organisations like CCF or CCF itself felt that we could be helpful. Okay, so sorry, that's not what I wanted. That's it. These are some of the projects that we have helped with. Now, what Helen is going to be doing is updating this very soon, but I hope you can, I'm not going to read them all out, but some of them about young people's social prescribing I've mentioned. There was another one from Nine Maidens School. I don't know whether you know Nine Maidens School, but Nine Maidens, what they do is they look after children who have been excluded for one reason or another from mainstream schools. They look after them there. And basically what they then do is try to bring those children back into a mainstream provision. The children approached us and said, how would we feel about giving them some money, because they wanted to create, out of an office that was not being used, they wanted to create a safe, quiet space. We thought this was a really good idea, but what we thought was an even better idea was if we asked the children to work with us on describing their project, drawing up their plans, discussing with their teachers how they'd manage it within the school, then doing the ordering, doing the buying, doing the sorting out as what was going to be a good deal and what was not. And they thought this was a wonderful idea. What that led to was those children who, you'd say sometimes could be quite challenging, those children produced an exhibition for us. All sorts of drawings, all sorts of written work about actually how they felt about life so far, how life had treated them, how things were going well, how they were not going well, etc. I have to say it reduced some of our trustees to tears reading some of the stories from these children. But they then put their bid in. The trustees said, right, okay, well, you can have that amount of money, and they granted them, I think it was £8,000 to do this project that they wanted to do. When they were doing it, there were all sorts of visits to see how things were going and to talk to them about it, etc., etc. One young man produced a bunch of flowers for one of our trustees, which reduced her to tears straight away, which, just so thoughtful. But they got to the end of the project and they said, well, we've got everything we set out to get and we've got some money left over. So they asked permission to spend the money left over, and of course we were very happy to say, yes, go ahead. So for every classroom at Nine Maidens, they then produced what they called a pod, a sort of, like those nice chairs you get to go outside, they're sort of egg-shaped. So they produced something like that to go in each classroom, so that if somebody wanted to be quiet and just read or just reflect or whatever, they could sit in that. And I just thought it was such a wonderful idea. But for me, as an ex-teacher, I don't think you ever get ex, actually, but anyway, as a teacher, to see the way those children grew doing that project and how they learned, that will have taught them as much as anything else for their future life, and I'm just delighted to be able to do that. But just as some of the breadth of the things that we've been doing, Admiral Nursing at Trelisk, for people with dementia and their families, we have been supporting the equivalent of a salary for an Admiral Nurse at Trelisk. Besent's Farm, some of you will know about Besent's Farm down at Hale for treatment of drug and alcohol addiction. We've had an ongoing relationship with them, and I think probably I'd emphasise to you that we don't have time-related award giving. In other words, we don't say, if you make an application this year, you can't have anything next year. If you make an application and you fail, you've got to wait so long before you can try again. We don't do that. We build up a relationship with an organisation, and we actually try and encourage them to talk to us, not just about their application for grant, but actually how things are going. So we will ask them at some point to either come and do a presentation to the board or at our AGM, or to just send us a report, or to send us some photographs or whatever. And Thomas did a wonderful report and came to the board and talked to us about that with everything that our 50,000 was spent on. So Besent's Farm, for example, I know that they've had more than one application in with us and been successful. So, and it's not to say that they can never have another one. They could, but it depends what it's for. So each one is looked at freshly. Children's Sailing Trust, we've again helped multiple numbers of sailing organisations, because I think we all believe that outdoor activity of any sort, particularly sailing in a county like ours, is really important, and children get so much from it, so we've supported them. And I don't know whether you know of an organisation called Trelia, which actually operates out of Penzance, but if you don't know it and you're involved in community organisations, you might very well want to go and visit. It's quite a remarkable organisation run by a lady called Sharon Rich. And basically what they've got there, you know that the Truro estate in Penzance is the most deprived estate in the whole of the county. What they've got there is some buildings that were the beginning part of Humphrey Davy School years ago before they put it all on one site. So they're quite substantial buildings. But they've got classes running there for just about every age group. But they aim to get alongside members of the community. So that one of the biggest problems, of course, used to be teenage pregnancy. But they get alongside young people on that estate and they help to stop that happening. Not in a sort of you will not type approach, which goes down really well, as you know, with young people. This is about getting alongside and showing them that there is life which is beneficial to them, that there is hope, that there are things that they can do and things that they can achieve. And I think that is worth so much. But they also work right the way through with the age groups to try and help people into work. So if they haven't had an experience of working for some years or perhaps ever, they can help there. So again, a very, very good organisation. In contrast, Lambeig Hall, Lambeig, I'm saying it properly, aren't I? Yeah, Lambeig at Coverack, we help them to improve their access for their hall, because their hall is right down the cliff. It's very close to the sea in some ways, but it's steps. And of course, some of the people that they wanted to run things for couldn't get there. So we helped them to change the steps to a ramp, because that was clearly what was going to be beneficial. More widely, recently we've helped Marie Curie with bereavement support service for the whole of Cornwall. So coming from the localised to the general, right across Cornwall, they've helped them. And again, Brooke, who do sexual services in schools, we've helped them. Age UK, and this is for Cornwall and the Isles of Scilly, Pain Cafe and social prescribing, and a community garden. So all of those things. And as I say, Helen will be updating that list very shortly to include some that we just had a grants meeting last Monday, and we had 14 applications for grants and granted funding of, I think it was about £80,000 worth in total we agreed to on Monday. So, there we are. Oh, there. A map. One of the things that we are all very keen on the board is that we should work hard to make sure that all areas of Cornwall, because we are for Cornwall and in Cornwall and nowhere else basically, the sole purpose is Cornwall and Cornwall benefits, but we like to keep a map of where we've given money to, and you can see there are some sizable gaps there. So we have over the last 12 months been really working hard to plug those gaps. I'm not sure we shall ever get very many flags up on the moor, but looking at South East Cornwall, that's not too good, and North is not too good either. So we're looking at those areas. So if you have an idea or you have a project and you think that we can help, please do get in touch. And if we think that we can't help you, then we'll do our level best to find somebody that can. So we very much work on a can-do attitude to what we receive, not to turning people down unless we absolutely feel that we can go no further.